Hi, I'm Dr. David Meyer.
And I'm Dr. Peige Zhou. We are part of Georgia Colon and Rectal Surgical Associates. Today we will be talking about what to expect for your colonoscopy.
A colonoscopy is a medical procedure used to examine the inside of your colon or the large intestine for signs of abnormalities such as polyps, inflammation, or cancer. It is a routine and safe procedure recommended for individuals aged 45 and older or those with a family history of colon disease. Colonoscopy can help diagnose digestive issues such as Crohn's disease, ulcerative colitis, or other gastrointestinal concerns. It can identify and remove polyps before they become cancerous and can detect early signs of colorectal cancer, increasing the chance of successful treatment.
Before the procedure, it is important to prepare your colon in order to get the best view possible. Your doctor will provide specific instructions on how to prepare, which will include dietary restrictions, a bowel preparation, and medication adjustments. These dietary restrictions may include following a clear liquid diet 24 hours before the procedure and avoiding certain red colored dye. The bowel preparation will be administered to you by the office, and we will discuss a few different bowel preps in a moment, but it's important to follow the directions carefully. Medication adjustments may include avoiding blood thinners, diabetes medications, or supplements.
For your bowel preparation, a laxative solution will be prescribed to cleanse your colon prior to the procedure. It is important to follow instructions carefully for an effective examination. Usually, the prep will be performed the afternoon and evening prior to the procedure, but if your colonoscopy is scheduled in the afternoon, you may be asked to perform a split prep where some of the prep is completed the morning of the colonoscopy. The typical prep in my office is a Miralax-based prep, which includes Dulcolax tablets, an entire bottle of Miralax, into 4 bottles of Gatorade. But many patients ask about alternative preps. There are some pre-mixed preps that can be prescribed. There are some low volume preps or tablet-based preps like Suprep or Sutab. These can be offered, but they still do require you to drink large volumes of liquid to accompany the prep.
On the day of the colonoscopy, you will arrive at the endoscopy center to check in. You will need to have someone accompanying you to the procedure that will be able to drive you home. When you arrive, you will check in at the reception desk where the staff will confirm your appointment and review your medical history. You will be asked to change into a hospital gown, and a nurse will take your vital signs. An intravenous or IV line will be placed to administer the sedation during the procedure.
During the procedure, the colonoscopy is typically performed under sedation or light anesthesia, so you will be comfortable and unlikely to remember the procedure. A thin, flexible tube with a camera, called a colonoscope, will be gently inserted into your rectum to examine the colon. Your doctor may remove small polyps or take tissue samples or biopsies if needed. The entire procedure usually lasts around 30 minutes.
After the procedure, you will be transferred to the recovery area where you will be monitored for a short amount of time until the sedation wears off. You may experience some mild bloating or cramping, which usually will resolve within a few hours. Due to the sedation effects, you'll be asked to have someone drive you home, and you may not drive for the remainder of that day. You will typically resume normal activities the next day.
Most patients recover smoothly, but please contact your doctor if you experience severe abdominal pain or persistent bloating, heavy rectal bleeding, fevers or chills, or dizziness or weakness after your procedure.
A colonoscopy is a vital tool in maintaining digestive health and preventing colon cancer. While preparation may seem challenging, the benefits of early detection far outweigh the temporary inconvenience.
Thank you again for listening today. If you have any concerns, do not hesitate to discuss them with your healthcare provider.